Does your denture move around when you eat or speak? Are you tired of the sticky mess of denture paste? What if you can get a denture that snaps in and doesn't move around? No more messy goo and you can eat the foods you love. An overdenture may be the perfect solution for you. Hi dental fans, I'm Dr. Rich, a general dentist with over 20 years of experience helping you learn about dentistry and teeth so that you can have a very nice smile. In this video, I'm going to explain what is an overdenture. In basic terms, an overdenture is a denture that fits over some implants or over a metal bar that is attached to implants. The fact that you as a patient can remove the denture at home makes it an overdenture. There are two different types of overdentures. One is called an implant retained overdenture, which means the implants hold the denture in so that it doesn't move around, but the implants don't hold the denture up, which means that the denture is held up by your gums. The second type of overdenture is called an implant supported overdenture. This type of overdenture is actually held up by the implants and not by your gums. It usually consists of a metal bar which is attached to implants, and then the overdenture snaps onto the metal bar. There are pros and cons to each type of overdenture. To learn more, check out my video called Different Implant Overdentures, in which I go over the pros and cons of both types of overdenture. I'll leave a link to it up here on the card as well as down in the description. For an implant retained overdenture, since the implants only hold it in, I start by making you a very well-fitting denture. In addition, I have a dental lab make a strong metal framework which will be embedded into the plastic of the denture. An overdenture needs the strong metal framework for two reasons. Reason number one is the snaps that attach the overdenture to the implants need to fit inside the overdenture. The overdenture is hollowed out in the areas where the snaps will go. This weakens the overdenture. The metal framework reinforces the plastic around the hollowed out area and helps prevent it breaking. Reason number two is now because your denture doesn't move around, you are able to bite harder and chew better. The increased chewing force may crack the plastic of the overdenture. The metal framework strengthens it and helps prevent it from cracking, similar to how steel rebar is used to make concrete stronger. Once the overdenture is made with the metal framework inside it, I'll attach the snaps to the overdenture while you're in my office. For an implant-supported overdenture, I start out by making a good denture as well as a metal bar that attaches to your implants. The inside of the denture needs to be made out of metal so that it could fit onto the metal bar and clip onto it securely. If the denture used only plastic, it would wear out quickly from rubbing on the metal bar. Once the metal bar is in place on your implants and the overdenture is clipped onto the bar, very little pressure is transferred to your gums. The implants are taking all the biting and chewing force. The nice thing about either type of overdenture is that I can make you an upper overdenture that doesn't cover the roof of your mouth, so you'll be able to taste your food better. So those are the two options for removable overdentures. Talk to your dentist about which may be the best for your situation. Also, permanent implant teeth are another option. I'll go over the permanent implant teeth options in another video. Each option has pros and cons. Make sure you get all the information so that you can make an informed decision so that you can enjoy your very nice smile. Thanks very much for watching, and if you've enjoyed this video, please subscribe. I post new videos every week. See you in the next video.